During the last 3 or 4 years, there have been 7 new treatments that have been approved for advanced prostate cancer. The first effective therapy for any cancer was prostate cancer, and that was orchiectomy or estrogens, and that was back in the 1940s. So we need the male hormone testosterone, and if you alter it, and that's been the mainstay of therapy for years. One of the new treatments is a treatment called Degarelix, which lowers testosterone very effectively and really starves the cells, and has actually been shown to have some advantages over the standard ways that we lower testosterone with LHRH agonists, they're called. It also has some effect on a compound called FSH, which is stimulatory. As regarding bone, prostate cancer likes to spread the bone, so we have some bone protective agents. We have something called denosumab, which is a drug Amgen has, which is a sub-Q injection, which prevents bone destruction and actually something called skeletal-related events. Another exciting area of treatment is immunotherapy. And in fact, the only immunotherapy drug approved for prostate cancer is one called sipuleucel T, or Provenge. And this is given with 3 injections over a period of 6 weeks to the patient. We've shown that if you give this in patients earlier when their PSA is not real high, like less than 20, and they're refractory to we call hormone therapy, that their improvement in survival rate is actually 18 months versus when you give it later, just 4 months. So that's that's an exciting new way to treat prostate cancer. The other thing that we have is a drug called abiraterone. Abiraterone is a drug that interferes with the production of testosterone. We have another drug called enzalutamide, which interferes with the binding of testosterone to the receptor, and that's being used earlier in the disease. And just recently, a drug called radium-223, which is a radioactive particle that focuses on active bone and showed the improved survival rate in prostate cancer. And we have a couple other ones coming down the pike. So exciting new era in prostate cancer, advanced disease. There's the hope of prolonging survival, and yes, we have. And, I have this hope that when we put these things together, that we actually can turn this into a chronic disease and improve outcomes.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.